Good morning, good afternoon, good evening, depending where you are based, and welcome to the 2025 edition of the Global Public Health Week, an initiative of the World Federation of Public Health Association. I am Marta Lamazzi, Chief Operating Officer of the World Federation of Public Health Association, and I'm really pleased to be here today with one of the young professionals collaborating with us, Maya Jones. Welcome, Maya.
Thank you. Hello.
So I want to discuss with Maya about public health. But before starting discussing about her vision, Maya, may I ask you to introduce yourself?
Absolutely. So my name is Maya Jones. I'm currently based in London, and I've just finished my master's degree in health psychology, where I had the fantastic opportunity to be an intern with the World Federation of Public Health Associations. So I've been an intern here now for about 4 months, where I've also been working part-time for a mental health charity.
Amazing, and we really hope you have enjoyed the time spent with us.
It's been fantastic.
Thank you. So based on your experience with us in the charity, at school, in your life, what is your vision for the future of public health?
So I have a number of visions across many fields in which the World Federation of Public Health Associations are involved, whether that be with the environment, immunization. But having worked with the tobacco working groups during my time with the WFPHA, I would say that my vision has become very clear for public health in regards to tobacco and e-cigarette use. I would say that my vision has 3 components to it. The first vision is to prevent people from starting smoking, and this is particularly children. So this is whether this is preventing the marketing or changing the marketing so it's not targeting children anymore. It's preventing people from starting this habit, which has become such a public health issue now. The second area of my vision is to do with helping people who currently smoke to quit smoking. So this is making sure that there's enough evidence-based practices that can help people stop smoking and maintain this stopping smoking as well, which is really important. And then the final side of my vision is to prevent people who don't smoke or who have never smoked from being exposed to secondhand smoke. So this will be in the form of policies and guidelines across many different countries to make sure that people can't smoke within a certain distance of schools, that cigarettes can't be sold within certain areas, and that there are designated smoking areas so that people don't get exposed to this secondhand smoke. And so overall, my vision is to try and reduce this huge burden of a non-communicable disease, so that our health systems can focus more on communicable diseases and something that requires a collaborative effort towards. So hopefully by reducing one of the leading causes of preventable deaths worldwide, then we can see a shift in our healthcare systems that prioritizes something requiring more of our efforts.
Absolutely, and removing the risk factors. Tobacco
Absolutely.
is one of them. Of many NCDs can really make a change and also give more breadth to our health system to focus on other priorities. So, very good vision, very difficult to reach. What will be your role?
It is very difficult to reach, but something that I've really started to believe by being an intern with the WFPHA is that it's a lot more possible than it seems. And so what I see my role being is contributing further to this evidence base. And I've already been able to be involved in this slightly I've been working with John Gannon, who is a member of the tobacco working group based in Ireland. And together we've been working on publishing a paper that looks at 18 to 34-year-olds' attitudes toward tobacco endgame and also e-cigarette regulations. And what we've seen from this research is that it seems a lot more feasible than we originally thought to actually implement a lot of these measures. So I hope to be more involved in research like this that will understand the feasibility of measures before we waste time putting them in if they're not even going to work. So for me, I can see being involved in this research on feasibility and effectiveness and making sure that everything that we do is evidence-based. That's how I see the first part of my involvement. Then I also continue to see myself building relationships with like-minded people in this area. I've had a fantastic opportunity to meet people from all around the world who share this same vision. And I think as difficult as it is, like you said, to achieve a vision like this, when everyone puts their minds together and everyone from across the world with different guidelines, different policies, and different laws come together, then I think there's this common ground that can be found where we can really make a difference and we can really start to eliminate tobacco and reduce e-cigarettes, or at least approach them with the same regulations that we approach cigarettes with. And then beyond that, I think outside of my work with the WFPHA, I see myself being involved in this vision by making an effort to even help one person believe this or to even educate one person. I've really noticed myself taking the education and my learnings from working with the tobacco and e-cigarette working groups and applying it to other areas of my life, whether it be in working with a mental health charity where I've been helping to educate a lot of the patients on the importance of quitting smoking and also services that can help them to quit smoking. So for me, I think it's about seeing that big vision, but also seeing that you can help one person at a time, and that can help contribute to this overall public health vision. And so that's the role that I see myself playing in it.
Amazing. And I really wish you to make it happen, and I'm sure it will be. So many, many messages. Prevention is possible, is less difficult than we can imagine. Scientific evidence, making sure everything is based in the rooted in science, very, very important, and collaboration within and among countries, among professionals to make sure your vision become a reality. So putting all together, if you want to give one take-home message to the people listening to the Global Public Health Weeks, what would it be?
It would be that things can feel daunting and things can feel like a challenge, but when you collaborate and you have a team who are like-minded with you and who share your same values and passion, anything is possible. And it's just about taking that first step and seeing the knock-on effect that that can have. So I would say when it comes to public health, be brave and take that first step, and you'll see that change.
And with this very good message of be brave and start whatever you have in mind and in your heart. We thanks very much Maya for her contribution to the Global Public Health Week, for sharing your vision. And we invite you all to listen also to the other brief interview we have done to young professionals to share their vision for the future. I wish you all a very nice rest of the day.
Thank you so much for your time.